But our top story tonight remains the position across India. So let's first go to our magic wall to tell you what is happening across India in the fight against COVID. Now, these are the big numbers that you need to look at. At the moment, total number of cases 23,452. Deaths are 723. This is as of 8:30 p.m. today. In the last 24 hours, the new cases are 1752. Deaths are 37. So the number of new cases have spiked up. Let's take a look at Maharashtra, which is the state with the largest number of cases, 6,430, deaths 283. The other state to look at is Gujarat, 2,624 cases, deaths are 112 here. So a high mortality rate in Gujarat at the moment. Delhi, 2,376, deaths 50. Delhi mortality rates are slowly coming down. Let's now look at, therefore, what is the big picture, because this could tell you how long the lockdown could last. Now, from the 2nd of April, if you look, the curve of cases is rising sharply. However, what you now see is possibly the new cases trend. And if you look at the new cases trend, this is cumulative cases, remember, total number, but the new cases is showing a gradual. The doubling is now taking place only every 10 days. And according to the government, if the lockdown stays, by the 16th of May, the critical date, we could see what they call a flattening of the curve. Now, that's not the only possible good news. There's more good news. And the other good news at the moment is quite simply this, that there is a strong possibility that plasma therapy could work. Because today the Delhi government, which is in the front line of the fight against corona, says that they have found that the plasma therapy is working on critical patients. At least 3 of them have recovered. And the Delhi government now wants plasma therapy to be expanded. Could this be a way to combat corona? Take a look at our top story.
190,000 and counting. The global death toll of a deadly virus has sparked humanity's biggest race. Find a cure, find a treatment, find something to fight the COVID-19 fatalities. Now an old treatment is gaining huge traction. Not as the silver bullet that will fell a deadly virus on the march, but a possible stopgap treatment until a vaccine is found. The convalescent plasma therapy, the approach called convalescent plasma, uses part of the blood that contains antibodies. Antibodies are proteins found in blood plasma that attack specific virus or bacteria like COVID-19. By giving these pre-made antibodies to a patient means they don't have to produce the same antibodies on their own. Importantly, these antibodies are procured from COVID-19 survivors, those who defeated the virus and formed antibodies against it. Delhi has conducted the plasma therapy on 4 patients at the LNJP hospital after a coronavirus positive patient was weaned off the ventilator at the Max hospital with the use of this therapy.
4 जो मरीज थे उसमें से 2 मरीजों को मंगलवार को प्लाज्मा दिया गया था, तो आज 3 दिन हो गए उन्हें प्लाज्मा दिए हुए। वो दोनों आईसीयू में थे और मुझे एलएनजेपी के मेडिकल डायरेक्टर जो हैं उन्होंने बताया है कि शायद आज उनको आईसीयू से निकाल के वार्ड में शिफ्ट कर दिया जाएगा।
It is important to note that the blood plasma therapy is not the first line of treatment, which till now continues to be the use of hydroxychloroquine and other antivirals. Only if the patient is experiencing lung collapse and is on ventilator, the blood plasma therapy could be useful. So until the world finds itself a cure, a vaccine, transferring immunity from those who fought and won to those who are fighting and struggling under the wrath of this deadly disease, could be that small silver lining in these bleak times. Bureau Report, India Today.
So is plasma therapy going to be the way forward in this fight against corona? I'm joined by very special guests, Dr. S.K. Sareen, Senior Professor and Head Department of hepatology. He's the director and the man who's leading this fight in Delhi against coronavirus. He's part of the Chief Minister's task force heading that. I'm also joined by Smriti Thakkar, COVID survivor and plasma donor. Sumiti Singh is also a COVID survivor and plasma donor. I'll come to you, Dr. Sareen, in a moment. Let's just listen in to Smriti and my other guest, Sumiti Singh. Smriti, I want to ask you this. Give us a sense, Sumiti, first, about you first survived the COVID, then donated blood plasma. What was in your mind when you decided to donate your blood plasma to save someone? Yes.
So the doctors informed me that I was an able body to be able to give blood plasma, which meant I didn't have any pre-existing illnesses. I had a good hemoglobin. I wasn't on any medication. So there were a couple of criteria that I needed to match to be able to donate my blood plasma. And the doctors informed me that I was somebody who was capable of doing it. And if I was willing, I could do it. So that's when I decided to donate my blood plasma. They also told me it is for a clinical trial and it might be useful in saving somebody's life. Okay. And that was one of the main reasons why I decided that, you know, if there's a way for me to give back, then this was it, and I should do it.
That's wonderful to hear from you. I also want to hear from my other guest for a moment. Ma'am, what about you? What was it that, were you apprehensive? Was there any worry there for you, Smriti Thakkar, when you decided to go ahead with this and donate plasma?
Yeah, I was first worried, but when they assured me that the whole procedure is very safe and there is no kind of blood loss or it won't affect your body or your immunity, and they are taking complete care of, like, you know, they have sanitized the whole room where this procedure happened since morning. So they took all the precautions, and there were like 8 to 9 doctors and nurses around me taking care of me. They provided me vitamins and everything. So then I had no questions of that.
Let me come to you, Dr. Sareen. You know, here we have two individuals who've gone ahead and gone through plasma therapy by giving their blood samples, and that has helped at least 4 people recover. Are we seeing this as a possible, are you going to scale it up now that you've been successful with these two, in these 4 cases?
Firstly, I must compliment these two ladies whom I cannot see, but I guess they must be very proud of what they have done. And I salute them, and I think the nation salutes them, and similar such donors. I'll just say we had a young boy yesterday who had come, who otherwise works abroad, and he says, well, I could do service when the Kargil and other things were there, but now I feel that as if I have gone to the border and I won a war, and not only won a war, I've saved another soldier of, you know, my battalion. And I think these feelings give the doctors, give the public a hope. And as I could hear the Bureau report that the plasma therapy has been explained, so I won't add much more, but I want to explain when and in which group of patients it might have some hope. So when somebody gets a virus like corona, it goes through the nose or mouth inside, and it replicates. So you have an initial period of about 7 to 8 days, then the virus is multiplying. You need to give an antiviral to suppress that, but you don't have antivirals. The second phase of the illness is when you have a lung phase, what you call as a phase in which lungs get infected. And in that phase, which lasts for another 7 to 10 days, you get infections, you have lung injury, what you call pneumonia and others. And the third phase is a cytokine phase, when the body, in the process of removing, makes huge amount of cytokines, which actually can cause clearance of the virus, but can also cause organ failure. In that third stage, there is very limited benefit. Patient has already gone to a stage when organs have all failed. First phase also may not be very true. So the actual period is when the patient has symptoms, he is not so moribund that he may pass out. The second phase where you can actually, plasma therapy can have a role. We can bind the virus. If you can pick up the patients early and they are very sick, even then you can do it, but not at the end of the book.
But
So
can you
in
scale
those
it up? Can you
patients,
scale
we had
it to
thought-
Can you scale it
And I
up,
would
doctor?
say-
Can you scale it up to 100, thousands? Can it go beyond?
Yeah,
or is it only to a few limited cases?
Of course, you can scale it to hundreds and thousands, and I'm sometimes amazed why the US had not done and witnessed. Let me just tell you how many trials are going on in the world today. Only 13, of which 7 are recruiting, 6 are not even recruiting any patients. 4 are in US, 1 is in Saudi, 1 is in Netherlands, and 1 is at ILBS, and I'm sure many would be coming. But as of now, you have to register as a phase 2 trials, which is dose finding, reality, is this product going to work or it can harm? And science, as you know, is only truth with no boundaries. So we are in the process in which we would like to say in next few days, and we may have some beginner's luck in the beginning, but science is not beginner's luck. We should be able to finish a few patients. We have initially 4, 2 more have been possibly given, so 6 patients have actually received these therapies. I can only say, and I am not entitled to say they have recovered, but they have benefited. Once only we see that these people are back home, then we can say, yes, we can scale up. And you know, in the darkest of the dark, even a small light, a small, matchstick can give you a ray of hope. So we cannot say it is a ray of hope like a sun ray, but yes, in scientific basis, I'm quite convinced that there is a hope. It can be scaled up. Let's say even our Honorable Chief Minister, Health Minister, they all appealed that people should come out and donate.
And there
How
is,
many
there
have
is no
recovered in
danger?
India? You say 4,000 out of so many.
And there are no, for the donor
No.
itself, the
So,
donor itself,
they
the donor
frequently
has no
ask-
problem?
See, 3 or 4 questions are required to be understood. And these people have asked. One of the questions was, if I give and I got corona, I recovered, now my body has made good antibodies, but I give it away. So will my body become
Yes.
weak? Can I get another attack of corona? No. If you give these antibodies, you make many, many times more antibodies, and you can actually be a donor. You can give every 3rd day, 7th day, 10th day, because you are not taking out the blood. Like in blood donation, you take out the blood. Here, like you give in dengue, a small amount of platelets or small plasma is taken out. Rest of the red cells, white cells go back. The only machine takes away this part, the rest goes back into you. So there is no weakness, and as these 2 girls very rightly, confirmed it, and the doctors are more careful about the safety of the donor. So to answer you, firstly, my immunity doesn't go down. I am as strong as ever, in fact can be stronger. My bone marrow will make new blood. Second, I can give many times. Third, one person can save many lives.
Right.
If he gives many times, he can give many lives. And here, we're talking of thousands.
So you're
And
saying,
I must
but
say
am
that
I correct?
why
that-
people are taking time, I do not know.
Am I correct, doctor, that infected people
Yes.
have to be the donor? Am I correct?
Absolutely infected, those who have recovered totally with no symptoms, and they have to have 2 swabs to be negative, that now I am not infected. My blood cannot infect anybody. So 2 swabs negative, totally recovered at least 2 weeks after recovery and in good health. And then there are criteria for donors. Hemoglobin is about 12,
Right.
age should be less than 50 or so, must not have multiple comorbidities. So similarly, so donor safety, and similarly for recipient.
Let me...
Every recipient is not fit to take. Somebody who is, sorry.
Yes, go ahead.
The recipient should have actually an oxygen which is less than 93%. So, and all of us breathe 10 times, 12 times in a minute. But he's breathing 30 times or more. So he's so sick. And also may require a ventilation. His saturation is low. Lungs have pneumonia. Such patients who otherwise do not have a hope
Right.
of possible survival may go on to ventilators and may die. such patients and healthy donors who have recovered, if they make a combination, I am sure this therapy should give us some positive results. And as you rightly said some time ago, there are no vaccines, there are no antivirals. We are at least 6 months away.
Right.
So this gap
could
we
be
should
filled.
bridge. We and the government of Delhi has made a huge effort to have a bank of such people who can give their plasma, who actually can go to anybody in future. So we can expand, as you asked, to hundreds, thousands of people.
You are giving.
And I hope first our results should be sound, should prove.
You're giving us very positive news here today, Doctor, because I know other states like Punjab have also now started this plasma therapy. Kerala, Punjab are all looking at plasma therapy. I just want to ask you a question there, Sumiti, because you're hearing Dr. Sareen. Now, he has said also earlier today, those who come forward to donate, it will be an act of true patriotism. Is this how you see this?
I'm very happy that doctor has said that, and when I was also donating it, then the doctors thanked me for for me to donate plasma, and for me it was I was like, why are they thanking me? I should be thanking them for the work that they're doing, and trying to come out with a cure and trying to save lives. So if patriotism is something that the doctors are also doing, and if I'm able to assist or anyone else is able to assist, then there's nothing like it. There's only gratitude from my side to be able to do this as well.
You know, this is positive news that we are getting. As we said, 4 patients seem to have recovered. Dr. Sareen, keep doing the work that you are doing at the moment and keep coming and telling us more details about how this work progresses. I appreciate my guests joining me. Remember, 5 states have now begun the use of plasma therapy. Thank you all very much for joining me here at the top of news today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.